Good morning to everybody. Welcome back to my opening lecture on effective communication. This is the third session of my lecture. I hope that you have watched my first and second session of the lecture, so you can continue to the third session of my lecture. The third session consists of the elements of communication, also the types of communication, some types of communication. Here again, we can see this diagram of the sender and the receiver. Before the sender send a message to the receiver, the sender has to prepare the message first. Prepare the message in such a way that the message can be easily understood and with the same understanding by the receiver. And the preparation of the message by the sender is called encoding. Encoding or the preparation of this message depends on the background of the receiver, so the sender can convey or deliver the message according to the background of the receiver, so that it can be easily be understood. So this is the process of encoding by the sender, and then the message that has been encoded by the sender is sent through the channel, the message, and received by the receiver. The receiver then tries to understand what the message has been sent to the sender. This process of understanding of the message is called decoding. So the receiver decodes the message and try to understand the information of the message that has been sent, and what the receiver has understand of the message then is delivered back to the sender by giving a feedback. So giving this feedback can have the sender knows that the message that has been sent either has been understood correctly by the receiver, or there is some misinformation or misunderstanding of the message. And this feedback can, again, the sender can give the feedback to the receiver about the message that has been sent. And this message, as we have mentioned before, is given or delivered through a certain channel. But this process of communication may not go smoothly. Maybe there will be some disturbance, interference, or noise that be caused by the situation, the environment, or by the background of the sender or the receiver that might affect the message that has been sent by the sender. And the process of this communication takes place in a certain time, in a certain place, in a certain situation. Like now, we are doing a lecture in this certain time where I have given this video making very several days before you are watching. So in a certain time, you are watching in another time, and the place is in a different place. Situation is one way. Now we will talk about the forms, many forms of communication. According to Nasir, there are three types of communication, how we communicate. There is aggressive communication, passive communication, and assertive communication. In aggressive communication, the sender is more imposing or more enforcing the knowledge of the message that is delivered by the sender to the receiver without allowing any feedback. Usually, this situation is where the sender is more superior to than the sender, that the receiver. Sorry. So, aggressive situation like this, aggressive communication usually occurs where the sender is uh, feels more superior than the receiver. So, the sender is forcing his will to the receiver. In the passive communication is the situation where the receiver, like we have mentioned on the aggressive communication, feels more inferior and the sender is more superior. So the sender is just passive in receiving the information. The third type, this is the best type of communication, is the assertive. This is what we should do when we are communicating with our patient. The sender in this situation is the doctor should have open mind, openness, and respect to the others, respect to the one who are receiving our message, and allow to the patient to give his or her opinions or ideas, and we should listen to these ideas or opinions of the patient. This is the assertive type. So we should have this type of communication when doing communication with our patients. Sorry. According to Adler and Norman, there is the verbal and non-verbal communication. The verbal communication is what I'm doing now. Orally, I'm between words, sentence through my speech, through my lecture, but also written message or written information is also known as verbal communication. While non-verbal communication is the expression or the gesture of the speaker or the sender. I will talk later on about the verbal and non-verbal communication. And now the barriers. There is a general barrier and there's a certain barrier on the patient. In general barrier, there may be a physical barrier, technical barrier, psychological barrier, socio-anthropological barrier, and language barrier. Physical may be caused by the distance of between the sender and the receiver. Like now, I'm in a certain place in a certain time while you are watching in your home, maybe. So I'm in Jakarta, or while you may be in other parts of Indonesia. Technical problems or technical barriers is caused by usually by the media that is used, like this online communication. There may be some technical problems on the internet communication, internet connection, and also by the device you are using. It may not be comfortable to have an online meeting with Zoom or Google Meeting and so on. Psychological barrier. Usually it is concerning the background of the sender and the background of the receiver. So both have a different level of psychological situation, and that may cause barrier. The social anthropological barriers are the backgrounds of the culture, social, the sender and the receiver that may be different. We know that Indonesia has many culture and many ethnic have different cultural backgrounds. Also, different language. Yeah? Language can become a barrier if you go to rural areas or some remote areas in Indonesia. In the patient perspective, and also maybe the sender, the barrier may be caused or influenced by the education level of the patient. Lower educated patient may have problems in understanding our message or our information, and also the level of health knowledge by the on the by the patient, and we have mentioned before the language of the patient, the cultural ethnic also, and the age. The age, there may be a general gap between generation gap between you as a young doctors and the older senior citizen, the older generation versus the millennial generation. Also, there will be maybe there will be a limitation in the cognitive level of the patient, critical thinking of the patient. Not it depends also on the education, the level of the patient. Sorry. The next also has the same influence, has depend also on the level of education, on understanding the medical and science terminology that is used by the sender. And the patient that are coming to us maybe in a stressful condition, emotional condition, where he or she is facing a certain health problem. And sometimes there are unequalness between the patient and health personnel, where the doctors or the health personnels feels more superior than the patient. So we have finished the third session, and we'll continue in short time in the fourth session, where we will talk more on the verbal and non-verbal communication. Thank you for your watching the third session. Thank you very much.